Good news, your pain can be managed. Stick with me today and we'll talk about the leading natural and prescription approaches to controlling your pain. My name is Dr. Kaiser, a board-certified neurologist with Dr. Neuro Matters. We're dedicated to talking about all things related to neurologic issues. If you have any things that you'd like to hear about, please let me know in the comments below. Today we're talking about burning feet and managing those terrible symptoms you've been having. Just as a quick recap, neuropathy tends to involve the very longest nerves from the spinal cord, and so symptoms start in people's toes before gradually over the course of years moving to ankles, knees, and eventually to people's fingertips. It's symmetric, it doesn't have profound weakness. Many people describe it to me like walking on rocks, shards of glass, hot coals. It sounds really terrible. So let's get into symptom management. So before we jump into the various treatment modalities, I think it's important to set proper expectations. I don't think it's realistic when dealing with any kind of a chronic pain to think that things will resolve entirely. But I generally want to divide the symptoms that somebody experiences with a neuropathy into both positive and negative symptoms. Positive symptoms would be things like burning and tingling. These symptoms respond well to treatments. The negative symptoms, the numbness, doesn't seem to respond well, and most of my patients will say they have ongoing numbness despite what treatment we offer. Now, I'd like to divide the treatments into both prescription and natural remedies. When looking at prescription medications, we often use medications in off-label ways. What I mean by that are medications intended for one purpose are used for this alternative purpose and often tend to work well. And so the two categories of medications I'd like to consider: first, antidepressants, and then anti-seizure medications. The antidepressant, venlafaxine and amitriptyline, duloxetine, these are all antidepressant medications. We don't know precisely how it helps with chronic pain, but certainly it may have benefits for mood, probably regulate some of the neurotransmitters, the chemicals that are released in the brain that may help to alleviate symptoms. Similarly, anti-seizure category of medications probably helps to regulate how the nerves are firing. We don't know precisely how they work, but they work pretty well. The two options generally are gabapentin and Lyrica. So I'd say talk with your primary care or neurologist about these options, and if they're right for you. The selection of medication is often based on risk factors, side effects, or other history and medical comorbidities. Generally speaking, narcotic medications are avoided. They don't really have a role in treating neuropathic pain. But I think with any treatment that you use, make sure that we give it adequate time. Any of the antidepressants, anti-seizure medications, they take probably weeks or maybe even months to be effective, and we often need escalating doses. If you find you're not getting the relief that you want to, again, make sure you're having that open conversation with your primary care doctor or neurologist so that they can properly adjust your medications, increase doses. Many people require combined treatments to get the relief they want. In addition to oral medications, there are topical medications, things that you can apply on the surface of your skin, such as capsaicin cream and lidocaine cream or patches. Capsaicin is extracted from peppers and applied directly to the area that's causing pain. And over the course of time, people will find that the nerves are desensitized. But leading up to that, many people will talk about burning, worsened burning, and so capsaicin is often not tolerated for that reason. Lidocaine is the same medication your dentist uses to numb your nerves or numb your teeth, and it can be applied directly to the surface of the skin, again, to help alleviate some of that burning, terrible pain. Now, if you've exhausted all of the medication options, there are some more aggressive surgical interventions, such as a spinal cord stimulator. You'd need to be referred to a pain medicine specialist for that. And I often refer people if I've tried all the medications and people are still not getting the relief that they want to. And the way that I think about the treatment in general is, think about if you've fallen down, you hit your knee, we instinctively reach down, we rub that area that's causing pain, and what we're doing is we're interfering with the transmission of painful signals for ones that are non-painful, that rubbing sensation rather than pain. And a spinal cord stimulator in many ways is doing the same thing. They implant this device in your back. It stimulates nerves to provide a non-painful stimulus that interferes with the transmission of pain. And for many people, it's the only thing that gives them relief. So keep that in mind. Now, before we jump into the natural approaches, If you're not subscribed to this channel, I hope you consider liking, subscribing, hit that bell for notifications so you're kept up to date on all of our most recent videos. Now, regarding natural approaches, there's conflicting evidence regarding most of these, but I think, personally speaking, if I developed a painful neuropathy, I would probably try several of these natural approaches first, just because I'm already taking medications for my thyroid and cholesterol, and I wouldn't want another prescription medication if I could try something that worked differently. Now, everybody that has some kind of a neuropathy should participate in regular exercise, take warm baths, and the idea behind that is promote peripheral circulation, general health, and this is really for the health of the nerves to keep them from getting injured on an ongoing basis. Now, some other natural treatments, acupuncture and applying a TENS unit, both of these therapies help to release endorphins, the body's natural pain treatment. TENS unit, if you're not familiar with that, they apply some electrodes to the surface of your skin. They apply some electrical current across those electrodes, and again, helps to release endorphins. Now, as far as vitamins, herbals, essential oils, I think with the exception of alpha lipoic acid, I don't know that there is great evidence. Some of my patients have told me about a treatment they use called Nerve Renew. To me, it feels kind of gimmicky, but they seem to suggest it really helped them. I looked at the ingredients for this, and it does contain alpha lipoic acid. Maybe that's what's doing it. Some of the other vitamins that are in there, if you look at one of my videos talking about the why behind neuropathy, perhaps they had some kind of deficiency that we weren't aware of, and maybe it helped with that way too. Low light therapy or near infrared therapy is intended to increase circulation in the periphery. I've seen patients spend thousands of dollars on this, having it done at some kind of a specialty provider. I think the data is not good enough to say that we should be doing that for all patients. I did find some devices on Amazon that suggest to offer the same treatment. I would probably try one of those before I would invest lots of money on some kind of a dedicated therapy. I've included some links for evidence regarding herbals, vitamins, as well as light therapy below. But as you can see, there's a number of treatment options out there, both prescription and natural, that may help alleviate your pain, although may not cure it entirely. Now, if you've got a special remedy that we did not speak about, but you'd like other people to know or want my opinion about, I'd love for you to include that in the comments. I hope you found this information useful, and if so, please again consider liking, subscribing. And this again is Dr. Kaiser from Dr. Neuromatters.